Hi guys, it's Simon C. Welcome to this new AI radar. Here you are, 3 fresh artificial intelligence news. Science Daily reports that scientists at the University of Southern California, Queen's University and Duke University, US, have developed a new tool to screen children for fetal alcohol spectrum disorder quickly and affordably, making it accessible to more children in remote locations worldwide. The tool uses a camera and computer vision to record children's eye movements and then identifies abnormal patterns. The technique was described in a study published in the journal Frontiers in Neurology. The new screening procedure can be applied to very young children. It takes only 10 to 20 minutes and the cost should be affordable in most cases. The machine learning pipeline behind this gives out objective and consistent estimations in minutes, said Cheng Zhang, a doctoral candidate from the neuroscience graduate program at USC and the paper's first author. While this computer vision tool is not intended to replace full diagnosis by professionals, it is intended to provide important feedback so that parents can ensure that their children are seen by professionals and receive early cognitive learning and potentially behavioral interventions. Kyle Wiggers reports on VentureBeat that researchers at Newcastle University and the Georgia Institute of Technology believe they've made progress toward an automated low-cost diagnostic solution for perinatal stroke that leverages a combination of wearables and artificial intelligence. In particular, this AI system involves outfitting newborns with body-worn sensors and applying general movement assessment algorithms to the data collected to detect movements characteristic of a stroke. Perinatal stroke is a stroke occurring before or around the time of an infant's birth that can lead to lifelong disability. It actually affects around 2 in 1,000 children, making it the most common motor disorder in childhood, points out Wiggers. The problem here is that the symptoms tend to be non-specific and the screening method used to pick up the stroke requires a lot of training. So researchers did the preliminary tests involving 34 infants, 13 of which had abnormal movements, in which the system identified likely cases of perinatal stroke over 75% of the time. These tests looks promising for the automation of perinatal stroke screening system at large scale. In fact, researchers' goal is to develop methods that enable population-wide minimal effort yet accurate assessment of every newborn that will lead not to fewer cases of perinatal stroke but to earlier detection of potential motor abnormalities. New Atlas contributor Ben Coxworth reports that scientists from the University of Toronto used machine learning to identify among children developing arthritis those with diffuse joint pain who might take longer to go into remission, allowing for their treatment to be tailored accordingly. Unfortunately, even children can develop arthritis indeed, and while some end up going into remission, the disease becomes much worse in others, points out Coxworth. To come out with their findings, scientists from the University of Toronto analyzed clinical data relating to 640 arthritic children, which was gathered between 2005 and 2010. The dataset included each patient's symptoms along with their outcomes. Machine learning algorithms discovered that most of the children could be sorted into one of several groups, reports Coxworth, depending on the area of the body in which the joint pain was present: the pelvic region, fingers, wrists, toes, knees and ankles, but that some of the patients didn't fit neatly into one group as their joint pain wasn't localized. It was these children who took longer to go into remission, ultimately faring worse than the others. Researchers now hope that as soon as a patient is identified as belonging to that non-last known group, doctors can set about administering fairly potent medications, perhaps improving the outcome. On the other hand, if the machine learning process determines that a child is likely to soon enter remission anyway, the use of medication can be minimized. This will both reduce costs and spare the patient from unnecessarily enduring side effects. Okay guys, it's all for today. See you next time with AI Radar. Bye!